Ever wondered what natural substances Amish communities use for their antibiotic properties before seeking modern medical care? Their traditional knowledge includes plants and foods with genuine antimicrobial effects that science has validated. Garlic power. Modern antibiotics target bacterial infections through specific chemical mechanisms, while Amish families often turn to garlic as a first line of defense for minor ailments. Garlic contains allicin, a sulfur compound that demonstrates genuine antimicrobial properties against certain bacteria and fungi. When crushed or chopped, garlic releases allicin, which has been scientifically shown to inhibit some bacterial growth, though it cannot replace prescription antibiotics for serious infections requiring medical intervention. Honey medicine. Contemporary wound care relies on sterile dressings and topical antibiotics for infection prevention. Amish communities have traditionally used raw honey, particularly manuka honey, for wound treatment and bacterial control. Medical research confirms that certain types of honey possess antibacterial properties due to low pH, hydrogen peroxide content, and unique compounds that create hostile environments for bacteria. However, honey should never replace proper wound care or antibiotics for serious infections, and infants under 12 months should not consume honey due to botulism risks. Herbal antibiotics. Modern medicine uses standardized pharmaceutical compounds with proven efficacy and dosage protocols for treating bacterial infections. Amish traditional medicine incorporates herbs like echinacea, golden seal, and oregano that contain compounds with antimicrobial properties. Echinacea may support immune function, golden seal contains berberine with antibacterial effects, and oregano oil has carvacrol and thymol compounds that demonstrate antimicrobial activity in laboratory studies. While these herbs show promise, their effectiveness varies significantly, and they cannot reliably treat serious bacterial infections that require prescription antibiotics and professional medical supervision. Apple cider vinegar. Pharmaceutical antibiotics provide targeted treatment for specific bacterial infections with predictable outcomes and dosing regimens established through clinical trials. Amish households commonly use apple cider vinegar for various health applications due to its acetic acid content, which creates acidic conditions that some bacteria cannot survive. Research indicates that apple cider vinegar may help with certain skin conditions and could have some antimicrobial effects when used topically. However, its internal use requires caution, as excessive consumption can damage tooth enamel, irritate the digestive system, and interact with medications. The acetic acid concentration in household vinegar is relatively low compared to medical-grade antiseptics, limiting its effectiveness against serious infections. While vinegar has legitimate uses in food preservation and some topical applications, it cannot substitute for proven antibiotic treatments when dealing with bacterial infections requiring medical intervention. Medical warning. Never use vinegar as primary treatment for infections requiring professional care. Tea tree applications. Modern topical antibiotics undergo rigorous testing for safety and efficacy before approval for human use, with standardized concentrations and application protocols. Amish communities have traditionally used tea tree oil as a natural antiseptic for cuts, scrapes, and skin conditions due to its terpene 4-ol content, which demonstrates antimicrobial activity against various bacteria and fungi. Scientific studies support tea tree oil's effectiveness for certain skin conditions like acne and athlete's foot when properly diluted. The oil's antimicrobial properties make it useful for minor topical applications, though proper dilution is crucial as undiluted tea tree oil can cause skin irritation, allergic reactions, and toxicity if ingested. Tea tree oil should never be taken internally as it can be toxic, and it cannot replace prescription antibiotics for serious skin infections or systemic bacterial infections. Pregnant women and children should use tea tree oil with extra caution, and patch testing is recommended before broader application. While tea tree oil has legitimate antimicrobial properties, it works best as a complementary treatment rather than primary therapy for bacterial infections requiring medical attention. Oregano oil. Prescription antibiotics provide targeted bacterial treatment with established efficacy rates and safety profiles developed through extensive clinical research and FDA approval processes. Traditional Amish medicine includes oregano oil, which contains carvacrol and thymol, DVOD, compounds that laboratory studies show can inhibit bacterial growth and demonstrate antifungal properties. Research indicates that oregano oil may have antimicrobial effects against certain bacteria, including some antibiotic-resistant strains in laboratory conditions. However, laboratory results don't always translate to clinical effectiveness in human infections, and oregano oil concentrations vary significantly between products and preparations. Oregano oil requires careful handling as it can cause skin and mucous membrane irritation, interact with blood-thinning medications, and potentially affect blood sugar levels. Internal use should be limited and supervised, as concentrated oregano oil can be toxic in large quantities. While oregano oil shows promise in research settings, it cannot replace proven antibiotic treatments for serious bacterial infections. Its antimicrobial properties work best for minor applications and as supportive therapy rather than primary treatment for infections requiring medical intervention. The concentration and purity of commercial oregano oil products vary widely, making consistent therapeutic effects difficult to achieve compared to standardized pharmaceutical antibiotics. Colloidal silver. Modern medicine relies on FDA-approved antibiotics with established safety profiles, dosing guidelines, and proven efficacy against specific bacterial infections through rigorous clinical testing. Historically, Amish communities and others have used colloidal silver preparations, believing in their antimicrobial properties, though this practice raises significant safety concerns. While silver does possess antimicrobial properties and is used in some medical devices and wound dressings, colloidal silver supplements lack FDA approval and can cause serious health problems, including argyria, permanent blue-gray skin discoloration that cannot be reversed. Silver particles can accumulate in organs, including the liver, kidneys, and brain, potentially causing long-term health complications. The concentrations and particle sizes in commercial colloidal silver products are not standardized, making consistent effects impossible to predict. Scientific evidence does not support colloidal silver's effectiveness for treating internal infections, and its use can interfere with absorption of prescription medications, including antibiotics and thyroid hormones. The EPA has issued warnings about colloidal silver products making unsubstantiated health claims. Medical professionals strongly discourage internal colloidal silver use due to toxicity risks and lack of proven benefits. While silver has legitimate antimicrobial applications in medical devices, consumer colloidal silver products pose risks that outweigh any potential benefits. Medical warning: colloidal silver can cause permanent skin discoloration and organ damage. Avoid internal use. Proper applications. Modern medical practice follows evidence-based protocols that determine when antibiotics are necessary versus when supportive care is appropriate, with healthcare professionals trained to distinguish between bacterial infections requiring antibiotic treatment and viral infections that antibiotics cannot treat. Traditional Amish approaches to natural antimicrobials work best for minor, superficial conditions that don't require prescription intervention. Appropriate applications might include minor cuts and scrapes, where honey or diluted tea tree oil could provide antiseptic benefits while the body's natural healing processes address the injury. For respiratory symptoms, some natural antimicrobials may provide comfort and support while the immune system fights viral infections, but they cannot treat bacterial pneumonia or strep throat, which require prescription antibiotics and medical supervision. Digestive issues might benefit from certain antimicrobial foods like garlic in cooking, but serious gastrointestinal infections need professional medical evaluation and possibly antibiotic treatment to prevent complications. The key distinction lies in severity and type of condition. Natural antimicrobials work best as preventive measures or supportive therapy for minor issues, while serious bacterial infections, including pneumonia, sepsis, urinary tract infections, and infected wounds, require immediate medical attention and prescription antibiotics. Warning signs requiring immediate medical care include high fever, spreading redness around wounds, difficulty breathing, severe pain, or worsening symptoms despite natural treatment attempts. Natural antimicrobials should complement, not replace, professional medical care when serious infections develop. Safety considerations. Pharmaceutical antibiotics undergo extensive safety testing with known side effect profiles, drug interactions, and contraindications clearly documented through clinical trials before FDA approval. Natural antimicrobials, while generally safer than prescription drugs, still carry risks and limitations that users must understand to avoid adverse effects. Dosage control represents a significant challenge with natural antimicrobials since concentrations vary widely between products and preparation methods. Unlike standardized medications, herbal preparations lack consistent potency, making therapeutic effects unpredictable and potentially dangerous if used inappropriately. Drug interactions occur with natural substances just as with pharmaceuticals. Garlic can increase bleeding risk when combined with blood thinners, while some herbs affect liver enzyme systems that metabolize other medications, potentially altering drug effectiveness or toxicity. Allergic reactions can develop to any natural substance, with some individuals experiencing severe reactions to essential oils, herbal preparations, or even common foods like honey. Patch testing and gradual introduction help identify sensitivities before broader use. Pregnancy and breastfeeding require extra caution with natural antimicrobials, as many herbs and essential oils can affect fetal development or pass through breast milk. Children have different metabolic rates and sensitivities, requiring modified dosing and careful supervision. Quality control issues plague the natural supplement industry, with contamination, mislabeling, and adulteration common problems that can lead to unexpected adverse effects or treatment failures. Most importantly, natural antimicrobials cannot treat life-threatening infections like meningitis, sepsis, or severe pneumonia that require immediate antibiotic intervention. Delaying proper medical treatment while attempting natural remedies can result in permanent disability or death from preventable complications. Scientific evidence. Evidence-based medicine relies on controlled clinical trials, peer-reviewed research, and systematic reviews to establish treatment efficacy and safety for human health conditions. While traditional knowledge provides valuable insights into natural antimicrobials, scientific validation reveals both genuine benefits and important limitations of these approaches. Laboratory studies demonstrate that many traditional antimicrobials do possess measurable antibacterial, antifungal, or antiviral properties. Garlic's allicin, honey's hydrogen peroxide content, and oregano oil's carvacrol show genuine antimicrobial activity against various pathogens in controlled laboratory conditions. However, laboratory effectiveness doesn't automatically translate to clinical success in treating human infections. Factors like bioavailability, tissue penetration, optimal dosing, and individual metabolic differences affect how natural antimicrobials work in living systems versus petri dishes. Some research supports specific applications: medical-grade honey for wound healing, tea tree oil for certain skin conditions, and garlic supplements for cardiovascular health. These studies provide evidence for targeted uses while highlighting limitations and appropriate applications. The research also reveals concerning gaps in knowledge about long-term safety, optimal dosing, standardization problems, and interactions with other treatments. Many traditional remedies lack sufficient clinical trials to establish safety and efficacy for specific medical conditions. Quality systematic reviews often conclude that while natural antimicrobials show promise, more rigorous research is needed before they can be recommended as primary treatments for bacterial infections. the evidence supports their use as complementary approaches rather than replacements for proven medical treatments. Importantly, no natural antimicrobial has demonstrated effectiveness equivalent to prescription antibiotics for serious bacterial infections. Research consistently shows that while natural substances may provide supportive benefits, they cannot replace modern medicine for life-threatening conditions requiring immediate and reliable antimicrobial intervention. The scientific evidence supports informed, cautious use of natural antimicrobials for appropriate conditions while maintaining realistic expectations about their capabilities and limitations.